Imagine a world where every meal doesn't end in some type of burning sensation or discomfort. That's probably what you're dealing with if you are experiencing ongoing acid reflux, heartburn, or GERD. If left untreated, it can lead to serious complications, including poor mineral absorption, poor productivity in life because you're just dealing with this symptom and it's weighing you down, poor sleep, difficulty getting to bed at night, and it can even lead to cancer. And the problem with traditional acid reflux medications is they do not get to the cause of the problem, but they merely treat the symptoms. And they can also contribute to many serious potential long-term complications to your health. These meds reduce your body's ability to absorb protein, minerals, can lead to osteoporosis and other long-term complications. Some are very addictive and very difficult to wean off of. I had a patient a few months ago come see me who was experiencing severe acid reflux. She couldn't lay down on her back at night. She had a difficulty swallowing food at times. Her throat would constrict and it would get stuck at times and she would choke. She couldn't lay on her back at night to sleep without getting burning in her stomach and esophagus, and she was just really in a bad way. She went the medical route and she had an endoscopy, which is a scope to see what's going on with your esophagus and stomach, and she was diagnosed with severe inflammation and acid reflux. So the doctor put her on a traditional acid reflux medication, and that reflux medication just didn't make her feel right. She felt uncomfortable. It just wasn't the right fit for her, and so she came to look for something natural. So she came to see me, and I did a full evaluation and found that she did certainly have some inflammation in the gut lining. She also had some enzyme and other stomach juice nutrient deficiencies, which we had to supply her with. We got her on the proper diet and supplement program, which I'm going to share with you shortly. And it took a few short weeks. She started to feel better and better, less and less symptoms. Now she's able to sleep on her back, sleep a full night. She doesn't choke anymore as long as she eats properly and takes some whole food supplements and digestive aids that I'm recommending. She's doing just fine. And this is something that over time we can heal and repair this gut area for her that's so inflamed and get her back on track, living a normal, healthy life. I had another patient several years back, and this male was in his 40s, and he was dealing with severe restriction and choking where food would get caught in his throat. He didn't have so much any burning or heartburn type symptoms, but he did also get some postnasal drip. He just had to eat very, very slowly, and it was just a real nuisance for him because he didn't know when he was going to choke, and he could be out, at a party, he could be with some clients, and all of a sudden this choking was very embarrassing for him. His case took actually a good 6 to 8 weeks to really remedy, and it was a similar situation as far as tweaking his diet, making sure he was on the correct digestive aids and supplements, all natural, of course, and we're going to get into that in just one second. But it took maybe 3 months before he really noticed some major improvements. He was dead set against taking any acid reflux medications because he just didn't want to compromise the absorption of protein and minerals, and he just didn't want to become addicted to something where he would have to take it for the rest of his life. So we were able to get to the cause of his choking in his situation and really handle that and give him his life back. There's a lot of different types of symptoms and cases out there of heartburn. Some people just get it occasionally. Some people, they just need one enzyme product or maybe just an adjustment in their diet. It just depends on the case, but one thing is certain: we will get to the cause of your heartburn, acid reflux, or GERD, and we will do it naturally and effectively. So let's get into the mechanism of what is actually occurring with proper digestion and improper digestion, which causes this acid reflux, GERD, heartburn situation. So the stomach's function is to make stomach juices that are very acidic. It's producing acidic stomach juices called hydrochloric acid. So the stomach should be acidic. When it makes the proper hydrochloric acid, what happens is protein gets digested properly, and everything below in the pancreas, liver, gallbladder, small intestine, large intestine, colon, everything, it sets everything up to work properly south of the stomach. So the function of the stomach is to make acid. Now, as we age, what happens is we do not make that stomach acid that we used to. In fact, by the time you're 40, you made about half the stomach acid that you did in your 20s or teens. So that gets compromised, and then what happens is the food does not get digested properly because of this lack of good stomach acid, which is native or natural to the stomach. When you're not digesting your food properly, what's going to happen is that food's going to sit in a warm, moist environment, which is the stomach, and it's going to cause foreign acids to be released because it's going to putrefy, it's going to rot. And those foreign acids are what often cause the symptoms of heartburn, that reflux, indigestion, bloating, heartburn, etc. Another thing that can happen is when the stomach is not acidic enough, there's a valve right between the esophagus and the stomach. And when that valve doesn't close properly, you're going to get backwash of the stomach juices into the esophagus, which is not where they're meant to be. And what happens over time is when you get that backwash or that reflux, that's going to wear down the lining of the esophagus, which can lead to a lot of problems. End result, esophageal cancer. So what causes that is when the stomach is not acid enough, that reflex for that valve to close isn't functioning properly. We need a very acid stomach for that valve to close. So some symptoms of acid reflux include, well, we talked about the burning, acid reflux type burning symptoms, right? But also you could have what is called postnasal drip. That's where that valve is just not closing and there's mucus kind of coming up and collecting in the sinuses, causing a postnasal drip. That can be a symptom of a lack of good stomach acid, causing sort of a histamine response in the body because of that foreign matter coming back into the esophagus. Other symptoms, actually there could be a structural issue with your diaphragm, and that's where the stomach actually gets stuck up above your diaphragm, called a hiatal hernia. That's something that you need to go to a good chiropractor or natural health improvement doc that does hands-on manual work that can help with that, actually pulling that esophagus, but pulling the stomach down below the diaphragm. We do that in our clinic on a regular basis. Other symptoms of reflux include coughing. Maybe you have a chronic cough. Yeah, that could be caused from a lack of good stomach juices, causing, again, a histamine response. You could have a lump in your throat that comes and goes. You could also have gas, bloating, or indigestion. If you've learned anything thus far, please leave a comment below. Let us know what you learned, and also feel free to like and subscribe as well. Now, some of you might be thinking, well, I've tried natural remedies before and it just hasn't really worked, or I like being on my reflux medication. Well, I understand that maybe some remedies haven't worked for you before, but when you're dealing with whole food supplements and standard processed supplements and some of the dietary recommendations that I'm going to give you, I would say I have a 90+% success rate in my clinic over about 25 years with addressing the cause of acid reflux, heartburn, or GERD. Okay? So you're in good hands, and the information I'm going to share with you today is extremely effective. Now, I highly recommend you work with a doctor, your medical doctor, if you're looking to get on a natural health improvement program with a doctor like me, and work with your doctor about any questions regarding your heartburn medication. Okay? But if you're looking for a natural approach, please listen, because I'm going to give you some great tips right now. So the first tip that I have for you is Zypan from Standard Process. This product has been around since 1959, and I have had hundreds and hundreds, probably thousands of patients on Zypan over the years. Not only just for heartburn, reflux, GERD, that type of thing, but a lot of people just don't digest and absorb their food like they should, and this is very helpful for it. So Zypan provides the stomach juices that your stomach needs to make it properly acidic. We want it that proper pH, right? So the protein can get digested and the food will not rot. We want it digested. Okay, so not only does it have that hydrochloric acid that supports the stomach juices, but it also has another enzyme called pepsin. And pepsin is very important. The stomach produces it and it breaks down proteins. Lastly, it has some pancreatic enzymes. Your pancreas, one of its functions is to make enzymes that help digest proteins, fats, and carbohydrates. So with Zypan, you're getting this concoction of the proper stuff that your stomach and digestive tract needs to properly digest and absorb food. And when you're doing that, that valve is going to close and not open. Remember, it's under neurological control. When you have proper stomach pH, then that valve is going to close and you're not going to get that backwash of that acidic contents into the esophagus causing those symptoms, right? And you're going to get proper digestion. My next tip is Gastrex from Standard Process. This pairs very nicely with the Zypan. And what Gastrex does is it actually soothes and heals the lining of the stomach and the small intestine. So it has proper whole food nutrients that help heal and soothe that. Sometimes you'll get one of those symptoms at night where you can't go to sleep without having some type of reflux. You lay down, you just can't lay down because when you lay down, that contents just sits there. And so what you can do is you can actually open up a couple of these Gastrex and you can put them in a warm glass of water and drink it, and it'll actually coat the lining of your esophagus and stomach and provide symptomatic relief while also healing and repairing that area. So I think of Gastrex as putting the fire out. Okay, it's something that you can take along with Zypan on a regular basis with each meal, and that's going to help with the healing and repair of the stomach lining. My next tip, Digest Forte. So Digest Forte has bitter herbs in it, and bitter herbs are very, very good at helping the stomach secrete the gastric juices. So it has a stimulatory effect. And in herbal therapy, bitters have been around for centuries. This has tangerine peel, ginger, and some other bitter herbs that will actually stimulate the gastric function to allow the body to actually digest properly. So I like to pair this with the Zypan and the Gastrex because it gives you that herbal component. And this triad works really, really well together. There have been times in the past where I've had a little postnasal drip from eating maybe something that I shouldn't have eaten. And what I'll often do is I'll actually suck on, or if I eat actually a very large meal, I will suck on a couple of these Digest, and they are bitter, and it just sort of primes the pump for digestion. And what I notice is I digest my food much more easily, especially if it's a big meal. And also I don't get that, that little postnasal drip, sinusy feeling a few minutes after eating. So give it a try. I've had good success with it personally, and so have my patients. Let me know if you've ever heard of Standard Process supplements or MediHerb products before, and if you've ever taken them. They're a whole food supplement line that I've used in my clinic for 25 years. I grew up taking them actually from my chiropractor. There's a organic farm up in Palmyra, Wisconsin that grows everything organically, and the majority of what they put in their products, they grow. And I'm telling you, they are the leaders in organic farming. They have up to 8 feet of soft, nutrient-rich topsoil that they grow so many different things there on, and it's just really a sight to behold. I'm actually going to be going up there in August. This is going to be my 6th trip, and I'm very excited to see what more information I can learn about these products, because they've helped myself, my family, and my patients for so many years. Before we get into the last tip, and it's probably one of the most important tips, so hang tight, we're going to get into that in just one second. What I'd like to do is, so we can reinforce what you've learned today, I'm going to offer you my free report on the myth of acid indigestion. And this is a handout, a quite detailed handout that I give all of my patients that are experiencing digestive issues or reflux, bloating, GERD. So please look in the description below and you can get that free report. Also, you're going to get 10% off your first order of any products on our Shopify store. Okay, let's get into the last tip. The last tip to handle acid reflux, GERD, heartburn is proper food combining. How you combine your food plays a big role in how you digest and limiting or minimizing or negating these acid reflux symptoms. So let me give you 3 tips. Number 1, try to avoid mixing protein, specifically animal protein, with high starchy carbohydrates. So you don't want to mix meat and potatoes. Potatoes are very starchy, and meat is obviously protein, right? Eggs with toast, spaghetti with meatballs, sandwiches. Sandwiches have the bread with the meat. What happens is the protein, the animal-based protein, is digested by acid juices, and the high starchy carbohydrates are produced or digested, not produced, but digested by alkaline juices or basic juices, the opposite of acid. So when you mix an acid and a base, if you remember from 8th grade chemistry class, what happens? It neutralizes, right? The acid gets neutral. So what happens in your stomach is that protein that's being digested, it doesn't get digested properly because the acidic juices are more neutral. And that causes that protein to rot and putrefy. And what happens then is you're going to get these foreign acids produced. That valve isn't going to close properly, and you're going to get symptoms of heartburn. Okay? So that's number 1. Don't mix protein with starch or high starchy carbs. Grains, potatoes, cookies, cakes, candies, pastries, donuts, waffles. You don't want to mix that with meat, fish, chicken, eggs, that type of thing. Number 2, try to avoid mixing high starch carbohydrates with fat. So fettuccine Alfredo, that's cheese with a lot of fat. And then you have the pasta, which is a high starch carbohydrate. Very difficult to digest, let alone for someone that has acid reflux symptoms or GERD. You want to avoid loading up on a white roll, which you really shouldn't eat anyways, but a lot of butter or oil. So you don't want to mix fats with high starch carbohydrates either. So when you look at the American diet, what do you see? Well, you see a lot of improperly combined foods. And if you have compromised digestion, you really shouldn't eat the starch with the protein because it's going to, again, compromise the stomach acid and complicate your problems even further. If you're feeling a little overwhelmed about this food combining, don't worry about it. Just look into it. Start to delve into it. A good rule of thumb is at dinner, you can always start there. Eat some protein with a salad and a green veggie, right? Skip the potato, skip the bread that night. For breakfast, maybe just eat a couple eggs with some bacon or maybe an avocado, right? So just work with this over time, and over time you'll realize when your digestive juices are flowing properly, you're not going to have these symptoms, and you're going to feel just so much better. You're going to feel lighter, less gassy, bloated, heartburny. It's just really going to help you in the long run. If you like this video, you're definitely going to want to take a look at my next video on bloating, because I'm going to get into that specific symptom much more intensively, and I'm also going to get into the food combining component and speak much more on that as well.